Anti-inflammatory diet has been proven effective in treating and managing neuropathic pain and depression following a spinal cord injury. However, many people find it challenging to stick to their diet plan. In 2018, Dr. Ali Bailey and her colleagues conducted a study that identifies barriers and facilitators to an anti-inflammatory diet in individuals with a spinal cord injury. In this video, let's take a look at what they found in this insightful study. In Dr. David Deto's lab, participants of this study were randomized into two groups. 12 people in the experimental group were asked to be placed on an anti-inflammatory diet. 8 others were placed in control group. Their diet and lifestyle were not altered. 3 months after, the benefits by being on anti-inflammatory diet were evident. People who were on the anti-inflammatory diet experienced on average 40% reduction in neuropathic pain and a 55% reduction in depression. However, 1 year after the study ended, compliance rate to the diet in the experimental group dropped from 89% to 43%, meaning only 43% of their food servings would have been allowed on the diet, 57% of their servings would have been considered cheating. As a result, Dr. Ali Bailey conducted a focus group to find out possible reasons as to why people on the anti-inflammatory diet slipped after a year, during which they identified 4 barriers among people who went back to their previous lifestyle. Lack of motivation was a big factor. After the study was over, they didn't have anyone to reinforce and encourage them to stay on the diet. And during social events where there was always a lot of food, family friends would encourage them to cheat, and it was hard to resist such temptations. Moreover, it's more expensive to shop for healthier and fresher food. The cost of buying supplements is also significant. And understandably, extra work is needed in preparing and shopping for certain items. Certain food can also be difficult to find in stores. The study also found 5 facilitators for people to remain on the diet. First, if a person has autonomy over their meal choice, or if they don't have to worry about cooking separately for the rest of the family, then that's helpful to stay on the diet. If a person lives with other family members and receives their support, better yet, if one or more family members go on the diet with them, then they are more likely to stick to it. Peer support is very important. Some people meet other dieters regularly to share recipes and talk about challenges. They even created Facebook groups to encourage each other. Improvement in health was a big push factor. Most people in the experimental group lost between 15 to 30 pounds during the 3 months. They also experienced reduced swelling in the lower limbs and better bowel function. And finally, when they incorporate a cheat day by treating themselves once a week and eat whatever they want, that makes the dieting much easier. This study offers an insight on how to be successful on dieting, but most importantly, it does prove that anti-inflammatory diet works in managing secondary complications following spinal cord injury. We hope that you will find this information helpful, and thank you for watching this video.